Most individuals don't realize they even have periodontal disease. They may notice that their toothbrush is a little pink when they get through brushing.
Okay.
And, you know, they say, well, my gums have always bled like that. Well, we know that that's a sign of disease. It's a sign of the infection when the gums are bleeding because, you know, if you had a sore on your hand and you washed your hand and it bled,
You do something about it.
you do something about it. But people don't do anything when their gums bleed because it's always been that way. Well, it's always been that way because they've always had gum infection because 50% of 6-year-olds have gum infection, gingivitis.
That small? That young?
That young. It's a disease that's contagious. It's passed from individuals to individuals. It is the most rampant disease of the human body.
Boy, I think I need to go to your dental school and learn something.
So, you know, bleeding is one sign. Puffy red gums is another sign that you may notice. Gums that are receding. There's other causes of gums receding too, but periodontal disease is a big factor. Breath problems. These bad bacteria produce what's called volatile sulfur compounds, and they produce breath problems. So, and teeth that shift and spaces developing between them. These are the more common signs of periodontal disease that the seniors will notice in their own mouths.
All right. So I am the senior, and I have periodontal disease, and I'm coming to you for help. You said you'd treat me, right?
Right.
And that treatment would consist of what?
Consists of helping you with your home care. And once we get that to a good level, as we were discussing a few
Now, when you
minutes ago.
say home care, you're talking about the brushing and the flossing both?
Brushing and flossing using hydrofloss.
What? Now, wait a minute. What is hydrofloss?
Hydrofloss is like a water pick. It's a
I know hydro means water, but...
Right. It's a little machine that pumps a pulsating stream of water.
Oh, okay.
And that water flushes the debris out from between your gum and the tooth.
Okay, that makes sense. But do you use a normal, just an ordinary floss first and then the hydrofloss?
You use floss first, and it should be an unwaxed floss.
Unwaxed?
Unwaxed. You've
Why?
heard of squeaky clean?
Yes.
When your teeth are cleaned well with floss, they squeak. So you know when you've done the job.
Really?
Yes.
See, something else you've taught me. But yes, I'd follow through on that.
So seniors that don't have the periodontal disease controlled or treated are subject to having double the risk of stroke and heart attack, increased risk for diabetes. It's been linked to Alzheimer's. It's been linked to several cancers, including squamous cell cancer, which was one of the most serious cancers of the mouth. It's also been linked to prostate cancer.
If you undergo a treatment for periodontal, how often do I have to come and see you?
It varies a little bit with the severity of it.
Okay.
And what we're going to do is we're going to do a thorough deep cleaning, what's called scaling and root planing. That removes the tartar and the toxins that are built up from the bacteria in the roots of your teeth. Once we do that, then we use a laser that helps to kill more of these bad bacteria, and it causes a regeneration of new tissue, new attachment, so that the pocket gets shallower.
Is there something you can use to coat the teeth for protection?
Not coat them, but there is a mouthwash and toothpaste that we've been using for the last 17 years. It was developed by a gum specialist. It kills these bad bacteria, and it neutralizes the volatile sulfur compounds that cause the bad breath.
And I suppose we never hear about that because, after all, anyone advertising their toothpaste would be apt to go after you because you're destroying their business.
Well, the company that makes the product that we found works exceptionally well didn't even sell retail to the public until about 5 years ago. You can only buy it through a dental office.
Well,
But it's called Closis, and it's a marvelous mouth rinse and toothpaste that just does a super job.
well, now I've heard of the mouthwash, but I didn't know that there was a toothpaste.
There's a toothpaste too.
Okay, so I've had another lesson. And I've known about the Closis for a couple of years.
Yeah, we probably talked about it before.
Well, we probably did. Just the minute you said it, I recognized the name again.
And
Well, we're going to take one quick break and then we'll come back again because I'm sure you've got a lot to tell me.
This program is sponsored in part by